Thank you everyone for being here. What a beautiful day for now, right? My name is Danny Camacho, CFO at Advent House Manchester. Thank you for joining us today for the official open house, the celebration of our new wound care department. We have we have many esteemed guests here, but a couple of special ones. Andrea Begley, who's representing U.S. Congressman Hal Rogers, as well as Mayor James Garrison. Thank you for being here. I want to welcome everyone to the campus of Advent House Manchester, where we are driven by our mission of providing holistic care to all people through our preeminent faith-based, consumer-focused clinical care. That's why we're here. This open house today is a culmination of many hours of work over the past couple of years between Advent Health and Restorix Health. Wound care services was identified as a need in this community, and we aim to fill it, and today we're showing that we're able to do that. Amen. We have assembled an amazing team here at Advent Health, a team of providers, clinical staff, led by our medical director, Dr. Greg Wilkins, and our amazing provider, Matthew Young, and our program director, Mary Ann Payne. Thank you for all the work you guys are doing. Amazing, high-level work that our patients are saying every day that they're thankful for. Thank you for that. We are proud to open the doors to the community and invite you inside to tour the facilities today and to join the celebration. Please join me in prayer as we dedicate these caregivers and this facility to extend the healing ministry of Christ. Dear Heavenly Father, thank you for bringing us here today on this beautiful day, on this great occasion here for Clay County, for Manchester, and for the amazing caregivers we have here on staff. Thank you for the opportunity to provide this service here. Help us to extend your service, your healing, your love, your compassion to everyone that walks on our campus. Please allow this to be the lighthouse, a beacon throughout the community to bring all who need help, who need healing, to come here and for allow us to be able to provide them the care that they need. Thank you for this opportunity and thank you for this celebration. In Jesus' name I pray, amen. And now we'll be, Andrea will be starting out with her remarks.
Well, good morning. It's an honor to be here today on behalf of Congressman Rogers to celebrate this new wound care clinic. Congressman Rogers was with us here in Manchester just a few weeks ago to celebrate the new Manchester Marketplace, and this new clinic is just another exciting thing in addition to the growth and progress that we are seeing here in Clay County. One thing we gained through COVID is a new appreciation for our healthcare workers and access to specialized healthcare. It's so nice to have this wound care center here in the heart of Manchester so our folks don't have to travel or search for transportation to make critical appointments, especially for wounds that need and require long-term care. So thank you, Advent Health Manchester, for expanding your roots here in Clay County for the benefit of our hometown people. Congressman Rogers is thrilled with the progress that you are making and the hope that you are bringing to our region. Thank you for inviting us to be a part of this event today. Thank you.
Now Mayor James Garrison will be able to speak with us.
Ones that know me know I ain't much of a speaker, but we're lucky to have this here in our community. I remember, I'm older than some of you out, and then some of you out remember Marie Langdon running around when I was a kid, raising money for beds and things like that in the community. And back in the 70s, and I ain't gonna tell my age or nothing like that, but a lot of communities don't have nothing like this, and we're just lucky to have this in our county right here. Amen. Other people have to come here from Owsley County and other places, and I want to thank Congressman Rogers and even Mitch McConnell for the things they do here and send stuff here to help us. Without this, without their help, we can't do this. But I've sat and watched this place grow, remodeled the hospital probably 10 times since I've worked here. I also work at the hospital. And, but just to watch the things that's going on, and we're getting here that we don't have to leave town to go somewhere else to get that provided to us right here in this community. And that's what I like, and I've told my pitch into the CEO there, what I'd like to see come. I've told every one of them, they're working on it, and I hope they get it one day. So I appreciate you all, and I appreciate the hospital and everything they do for our community here.
We're privileged to have Dr. Greg Wilkins, who's our medical director of the clinic, to speak with us today.
You know, I don't really know what to say to you all except for thank you for all that you've done for us here. We have, you know, our wonderful staff here that supports me in the clinic, and Matthew will be talking to you next, who I greatly appreciate because of his passion for wound care. It's really a privilege anytime you're expanding and adding services, and I'm just thankful that we're continually doing that here, that we have a real growth desire in this community, and I'm even more excited about the fact that we basically do this on the grounds of working with the Lord and partnering with Him. That we get to do this in a Christian manner, that we get to do this in a whole person care manner, that we care about, you know, making it easier to do it, making it better for the patient, caring for the whole health of the patient. Wound care patients are a special subgroup of patients that oftentimes have been very neglected. Their problems last for years. A patient I saw this morning, he told me the one wound was started in 2018, the other in 2019. It's been going on that long. And we see things like this commonly. And they've been through a lot of ups and downs and a lot of failures with their care. Yet with a dedicated team, and we have a dedicated team here, let me tell you, these nurses and everything are very dedicated. That approach can come through to the patients from the time they hit our doors, that we care about you, that we want to get you better. It's probably the most important aspect of wound care, because without that connection, the patients have failed, and you really need them to be willing to work with you and partner with you. And they have to believe again. They have to believe that they can get better again, because they can, and we've proven it over and over. But when you've had failures, like I just mentioned, just one, for years with something, it's hard to believe. It's just hard for us humans to believe. So first of all, it takes a staff that's dedicated and loving and tells them that yes, we have success, you'll have success, and be there. Then it takes a patient to buy into that and start doing that process. When they do, that teamwork brings about a beautiful thing, which is healing of something that's gone on for years that lots of people, they don't think can happen. And it creates a really interesting dynamic. Wound care patients are some of your most appreciative patients once they've been through the process and actually gotten healed. You know, not everybody does. Some people, because of family problems and other situations that are just so far outside of our control, they just stop coming, or they stop believing, and they lose hope. And, you know, if you lose hope in any situation, you really can't make progress forward. But a wound care team, and we get to do it especially because we are a special campus. We have, you know, the Lord working with us as well. And we can partner up, and we can bring that extra support to help get over a lot of those difficulties for patients. And we really go out of our way here with our wound care to do that, beyond just providing the service here, but trying to do those things. And those things make the difference in healing rates, and make the difference in outcomes, and really make the difference in our community. And so it's really a privilege for me to be part of that group. I'm just a small part of something that's doing really well. And I just thank everybody. Our administrative staff has put so much into it. Our nursing staff has supported. The fact that we got to move into a nicer facility, which allows for us to better handle some patients that we weren't able to take care of in our other facility. But each one of these measures adds up to something better for our community and better for ourselves, because when we are making a difference in people that really struggle to have a difference in their life, there's a real reward to that too. So I encourage any of you that know anybody out there that's really struggled with things for years, they're afraid to do it again, don't want to do it, but you know who they are. We all have family members with some chronic problems in the wound area generally, and if we can get them to come in through the doors and give them some family support from behind, we can make a difference. Yeah, it changes them. They need to change their diet if they have bad diabetes. There's things we all have to do, but we have the support network built here now for that. And I just want to say thank you to everybody. Thank you for the opportunity to share that about it. And I love you all. I appreciate you all. You've been just wonderful support to me here too. Thanks.
So we had a soft open of our wound care clinic here, but through the pandemic, it was really struggling. But after the last wave last fall, we added Matthew Young joined our team, and it's been growing by leaps and bounds. People just love him as well as Dr. Wilkins, and appreciate him being able to be part of our team. And now he'll speak with us now.
That's a tough speech to follow, but first off, I just want to thank everyone for coming out today. We are really excited about what we've done and what we've got going here, so we're really happy to have y'all here sharing this with us today. You know, it's kind of amazing to me, but next month will make 10 years I've been with this hospital. And throughout that time, you know, I saw wounds of every type and nature, and when they needed specialty services, people were having to go to Louisville, to Somerset, all over this state to get care. And I always wondered why we didn't have one of our own. So when this opened up, I was graduating nurse practitioner school, and I knew exactly where I wanted to be. So I'm just beyond blessed to be able to be a part of this. And you know, I am so proud and fortunate and blessed to be not only a part of what we have achieved, but what we think we can continue to achieve in the years to come. You know, as James Ed alluded to, we're not only caring for the residents of Clay County, but we've expanded to Owsley, Jackson, Leslie, all the others I can't remember. But we plan on continuing that, not only capturing the patients here, but in the neighboring counties, and providing a service that is much needed to everywhere around us. And so I, again, just want to say kind of what Dr. Wilkins was saying. None of this would be possible without all of you all the support that we've had from everyone around us, the amazing staff we have. Listen, I couldn't get through my day without the ones in that office with me. So Marianne, Sue, Tiffany, Sandra, thank you all. Dr. Wilkins, thank you for being such an amazing medical director. He has been a tremendous help for me. Any questions I've had, any patients I've had that I wasn't sure what to do with, I've had him right there with me every step of the way. So none of this would be possible without all of that. So thank you all. Appreciate it.
And now we'll have a patient testimony.
Hello, my name is Samuel Stidham. I'm here to share my story about the excellent care I received at Advent Health's wound care. On February the 27th, I had an emergency appendectomy to remove my appendix. And I formed an abscess from the surgery, and really, I got MRSA from the surgery. And I came to Advent Health to get a second opinion from Dr. Wilkins about my wound, and he immediately put me on the correct antibiotics to deal with MRSA, and he referred me to wound care, and they were able to clean the wound out and get it trending in the right direction. Initially, the MRSA infection was about the size of a golf ball, and when I actually got the appointment with Dr. Wilkins, it got to about the size of my fist. So that actually had me really afraid for my personal self. It was extremely painful. I was afraid that it was going to end up killing me, and I'm glad I got that second opinion and got in the hands of the wound care team. They used Dicon solution to clean the wound out twice a week, and they taught me how to, on the days that I'm not there, how to care for it properly and to keep it clean and to properly pack it. And without Dr. Wilkins and the wound care staff, probably would have ended up in the hospital again with a more serious infection. So they were amazing. They helped me out significantly, and I thank them very much for that. And the wound is almost completely closed now, and I'm living life like I normally did before, feeling great. And I highly recommend if you have a wound to get a referral to the wound care team. They'll take really good care of you.
So that's just one of many examples of patients that have come through here and received amazing care. Each and every day a new story is being written, and I really appreciate again the caregivers we have on staff here to be able to do that each and every day. And now we'll be joined by our CEO, Cecile Jacob.
On behalf of Advent Health, we thank you for joining us today to learn more about our wound care services right here in Manchester. Since the center's opening in July of 2020, we have seen our patient volume steadily increase, clearly indicating the vital need for wound care here and around Manchester. So as a result, we recently moved into this larger location right behind me to accommodate the growing need. The timing of this exciting move is perfect because we are celebrating the 2-year anniversary of the Wound Care Center. So in partnership with Restorix Health, this outpatient facility offers comprehensive approach for patients with non-healing wounds. Patients are examined by highly skilled clinicians, including affiliated providers and nurses with advanced training in wound care for conditions that would interfere with their healing. Utilizing evidence-based practice, the care team develops individualized treatment plans and collaborates with patients to provide maximum healing and relief. So thank you again for joining us for today's celebration. We do have some light refreshments for you immediately following the ribbon cutting. Thank you again.
And I'll go ahead and close out with a word of prayer, and then we'll go ahead and have the ribbon cutting over here. Dear Heavenly Father, thank you again for the amazing opportunity you provided to us here in this community. Thank you for allowing us to be a part of it at this moment in time. Please lead and guide us, be with the providers, our caregivers, be with those who are in need, help them to be able to come here and find the services that they're seeking. Help us to be able to provide to them a true, loving, compassionate care that they're needing. Not just to heal their wound on the outside, but also on the inside. Thank you for this opportunity. In Jesus' name I pray, amen. Now the chamber folks will come join us over here. We'll do ribbon cutting, and if you want to join us over here, and we'll do it on this side.
2, 3, 2, 1. Hold on, let's real quick. Here we go, smile big. 3, 2, 1. Awesome.
I like to say a few things from the chamber aspect before we conclude. It's not really related to wound care, it's related to Advent in itself. Most of y'all look like you are Advent employees, so you probably know some of the things I'm going to say. But Advent has 560 plus employees. They've got clinics scattered out, several here in the county, some outside the county. And they have spent $33 million in the last 4 years to improve their facilities to help with health care and improve the way of life for Clay counties. And I think that is truly amazing. And a big congratulations to them on that part. That shows where their heart's at. Not only in their healthcare aspects of it, but they're just a vital part of our community. When we need something, they're there. When we have something to happen, a flood or whatever, they're there. They're just an asset and a pillar to our community. I was an RN here at the emergency room from '92 to about 2002, and just the growth of this facility has just been incomparable to anything I've seen. They're all about Clay County, and they're all about the people of Clay County, and that means so much to me as a former healthcare worker and as a resident of Clay County. I think that's something we desperately need, and I would just like to congratulate and thank Advent Health for all that they do for us here in Clay County. Yeah.